Good afternoon, and thank you for joining me for a special edition of my COVID-19 community briefing. We have focused our briefing each week on the updates and the changes affecting the Anacortes community. This week, we have Dr. Libran here with us to answer some of our public health questions. Welcome, Dr. Libran. He will give us answers to your questions based on the best available science and his many years of medical experience. But just give me a few moments. I'm going to do my normal briefing, and then we'll get into our questions and answers with Dr. Libran. It's great to be here once again with you and to be with you week after week to keep you informed and up to date on the latest information. I can hardly believe that September is here and the fall is right around the corner. In July, remember July, Governor Inslee indefinitely extended his pause for a safe start plan to reopen the economy. The virus continues to control the situation, and only through our commitment to public health guidance and our hard work will we be able to eventually move to phase 3. It's especially important to reinforce the importance of following the public health guidelines now. Next Monday is Labor Day, which often means a long weekend, including people traveling or visiting family and friends. For Skagit County, which remains in phase 2, only essential travel and limited non-essential travel for phase 2 activities are permitted. In addition, only gatherings up to 5 people are permitted. So whatever activities you participate in this coming weekend should comply with the guidance. We need to think about how we can avoid the spike in cases that we saw after the 4th of July weekend. Our personal actions impact not only the health and the well-being of our community, but also our small businesses, retail, and restaurants. If we comply with public health guidance, that will move us to phase 3 more quickly. By not complying, we are limiting our small businesses' access to customers and limiting our ability to provide goods and services. We're headed in the right direction. In August, we saw 237 COVID-19 cases compared to July of 264 cases here in Skagit County. If we all play a part in moving our community to phase 3, no one person can do it. We must do it together. Let's keep it up. The city continues to provide essential services during this COVID times. As I mentioned, this Monday is Labor Day, and so the city will have no garbage service on Monday, but both Monday and Tuesday, customers will have pickup on Tuesday, September 8th. Our public library will also be closed for curbside service on Labor Day, but there are still many virtual story times and learning opportunities available online. In July and August alone, the library staff distributed over 7,200 books to citizens that use the curbside service. The library is hard at work at planning for the next program for you and something for you to enjoy this fall. Mount Eerie Road will be closed to motorized vehicles on Labor Day, Monday, September 7th. And this is for social distancing to keep our citizens safe. Please remember that when you're in the Anacortes parks or the Anacortes Community Forest lands, you should practice strict physical distancing and wear a mask whenever you're within 6 feet of someone and not engage in physical exercise. If you see an increased number of visitors, we recommend that you come back at another time when it's less busy. Please be respectful to others so we can all enjoy this weekend. Additionally, the Anacortes Park and Recreation Department, in partnership with Thrive Community Fitness, is offering a safe and distance fitness opportunity. Connect with yourself, your community, and the nature of this class designed to leave you feeling welcomed supported, and it's just the right amount of physical challenge. This is a great opportunity. Visit the City Park and Recreation Department's webpage for more information. Classes start on Wednesday, September 9th. The city is closely monitoring changes to the governor's Safe Start plan. New Phase 2 and 3 agritourism for COVID-19 requirements were released on August 28th. These changes allow animal viewing, hay and wagon rides, children's play equipment, and private fire pit and bonfires. Agritourism businesses are also permitted to provided they meet the new requirements. Some of the new activities include, but not limited to, Christmas tree farms, you-pick berry farms, corn mazes, and pumpkin patches. Each business will adopt a written procedure for operations that comply with all employee safety and health requirements. As we look towards fall and the holiday season, it's comforting to know that we'll be able to safely enjoy some of our favorite activities. Island Hospital continues to be supporting our community through this public health crisis and has tested a total of 4,600 people with a total of 53 positive cases, 10 hospitalized cases, and fortunately, we've had no deaths in Anacortes. The positive cases in Anacortes represent 5.2% of the overall cases in Skagit County and 11% of the hospitalized cases. So the Phase 3 metrics. These metrics are set by the state and they will eventually determine when we're able to move to Phase 3. Once the governor removes his pause for the Safe Start plan, we will need to meet all 5 of these metrics. Metric 1, we currently have 72.8 new cases per 100,000 residents. A county must have fewer than 25 cases per 100,000 residents over 14 consecutive days to meet this metric. And I'd like to remind you that prior to 4th of July weekend, we met that criteria. Criteria number 2, a county must have greater than 50 individuals tested per each new case during the prior week to meet this metric. We are awaiting updated information from the State Department of Health on this metric. Metric number 3, we have 2.3% of individuals testing positive. We must have less than 2% to meet this metric. Metric number 4, the percentage of beds occupied in the county must be less than 80%. We're currently at 76.3%. Metric number 5. Lastly, the percentage of those beds occupied by COVID-19 cases must be less than 10%, and we're currently at 3.3%. So currently, we meet 2 of the 5 metrics to move to Phase 3. In Skagit County, the Skagit County Health District reports 1,022 COVID cases, 22 fatalities, 93 hospitalizations. If you're not able to wear a mask, the Skagit County Health Department recommends you stay home as much as possible. Community transmission is happening, and masks remain one of our greatest tools in slowing the spread. Numbers continue to climb globally as the United States and countries around the world continue to struggle on how to beat COVID-19. There are over 25.8 million cases worldwide. The United States has just over 6 million cases and has had 183,050 deaths. Our continued commitment to beating the virus will save lives. Beginning this Monday, August 31st, the Skagit Valley College testing site is limiting those who work and live in Skagit County. This change was made as other counties, such as Whatcom, have opened up their own testing sites. This testing facility at Skagit Valley College will continue to be open Monday through Friday, 9 a.m. to 4 p.m. through at least December of this year. There have been 23,668 tests, with 556 people testing positive so far. If you believe you've been exposed, please get yourself tested. So now we're at our favorite part of our program, and today we have our guest, Dr. Laurie, and I want to thank all of those of you that have submitted questions and who have been active in helping fight COVID-19 in our community. My favorite part of the community briefing has always been our questions that you submit. And this week, to have Dr. Laurie here to help me answer your public health questions. So I'm going to tell you a little bit about Dr. Laurie. He is a native Washingtonian from Pierce County. His wife, Marilyn, is from right here in Anacortes. He attended Washington State University and then medical school at George Washington University in Washington, D.C. And we have seen and heard from Dr. Laurie a lot lately. He's been working hard to spread the facts regarding COVID-19. He's been working in the role of our public health office since 1989 and has substantial experience. He has worked as an emergency room physician from 1992 to 2018. He was a Skagit County jail physician for over 20 years, and he has over a decade of experience with addiction medicine. He's going to provide responses to your questions based on his extensive medical and public health background. We've received excellent questions from the public regarding public health, and I look forward to hearing your answers today. So, Dr. Laurie, I'm going to start with question number 1.
Okay.
And we have 7 questions for you today from the Anacortes community. So, question number 1, is it going to be safe to reopen our schools and our businesses without restrictions before we have a vaccine? That's the first part of the question. And why isn't the governor's Safe Start reopening plan based on when we have a vaccine?
So in reference to the schools and businesses, I'll talk about each of them separately.
Sure.
The schools, most of the schools in the district, or most of the districts in this county, don't have adequate space or staff to adequately mitigate against transmission in the school setting when we're at the rate that we are currently at. The most recent data, 72.8 cases per 100,000. We'd like to see that much lower before we attempt to open the schools in a more extensive basis. Meanwhile, though, we can, and the districts are planning to provide the services they can provide with the space their buildings have and the staffing levels that their districts have. So we will, and I think this is going to be moving forward as time goes on, as each school gets comfortable with dealing with the children in an on-site manner, then more and more opportunities will be given for different grade levels and different classifications of students to come back in person. Businesses, on the other hand, most of the businesses that we have can open now, and they are open now. I think the majority of businesses are open. The ones that are not open are the ones where many people congregate, because then we don't have a safe way to allow a mass of people to congregate. And, for example, in restaurants, we can't fully open the restaurants, we can't open the bars because there's no way to protect people in that situation. So as time goes on, we see modifications to the Safe Start plan. We don't move to a new phase yet, but we allow more things to happen as we learn how to do them safely. As far as the vaccine goes, the original phase reopening that Scott Gottlieb he's a former FDA commissioner, he and others' original plan was that phase 4 would be predicated on having a vaccine. And I think the reason that was taken out of most states' plans are that we don't know for sure even now that we're going to have a good vaccine. Progress is being made substantially. There's a lot more extensive testing being done, but this vaccine is too new for us to know how long it'll last, whether there will be complete protection from it, whether you need 2 boosters to start. I mean, there's lots of questions that haven't been answered yet. So to predicate opening on a vaccine is a little bit, well, you just don't have enough information to do that. Now, there are other ways which we could move to phase 4 if an effective vaccine is not found. And one of those is point-of-care rapid testing. And we're developing ways to do that, the antigen testing that can be done for as little as $1 to $2 per little dipstick, and it's done on saliva, and it gives you an answer within 15 minutes. If we can really make that widely available, then places like schools could do much more extensive testing and on a real-time basis have the results back and know whether the kids that day, those kids are safe from COVID. So we're looking forward certainly to phase 4, but it's still quite a ways in the future.
Okay, well, thank you. So question number 2. Why is it okay to see 5 people outside your household per week if infection rates are going up?
Well, it's all about balance. We learned in the first 3 months of this that it's really difficult to, live and thrive. And if you don't meet anyone outside your household, obviously that is going to stop the spread of the virus completely. That's just not possible to do, and it's not. It's just unsustainable. So for a given level of disease in a community, the chance of you contracting COVID from one of those 5 people, varies a lot. And at the given level where we are, 5 people is an acceptable risk. 10, 15, 20 is not. The maxim gather safe, gather small, I think is right on, because if you meet with 25 people from your family, these all be in your family, not in your household. Let's say there's 25 people from 5 households, and you have a gathering, and there's hugging and eating and face-to-face conversation and no mask, then that's a recipe for a disaster. And if there is someone at that gathering who is ill, infectious, but maybe not aware that they're sick yet, then a number of people in that gathering will get that. We've seen this many times. So the family transmission is probably the highest risk transmission. We'll talk about it a little more later, but I guess just in summary, it's unsustainable to not meet with everyone, and the number 5 is a compromise.
Okay, well, thank you. What I thought when I saw that is that also if you've only met with 5 people and you end up with COVID, then for you to trace where I got it, doesn't that simplify it if I've only seen 5 people rather than 125 people?
Right, it simplifies things totally. We have some of the people we do contact tracing on who have 25 or 30 close contacts in the last 5 or 6 days.
Oh, wow.
And it's obvious they're not following the guidelines. It's also obvious that they're fueling the expansion of the pandemic.
Okay, all right. So question number 3. Where is COVID-19 getting transmitted in Skagit County? That's part 1. And are the numbers we're seeing coming from small clustered outbreaks, retirement communities, church choirs, or transmission at workplaces? And is it because we're not wearing masks?
Well, geographically, COVID is distributed pretty much based on the population. A small town would have not very much, a larger town would have more, but there's not any specific clusters where it's a big problem. Of the clusters that we've seen, well, let's look at that another way. Of the last 99 cases, from August 15th through August 31st, we had 99 cases, and 32 of those were acquired through household contacts. 16 were acquired in the workplace. It's a little difficult sometimes to separate the workplace from household because many people who live together also work together. So you'll see a double transmission there, and it kind of fuels, each one fuels the other one.
So on your workplace, is that workplaces that don't have good practices in place? I mean,
that's dynamic because once transmission is identified, dramatic changes are made because it's so obvious to them then that it's important. But for the most part, well, I guess that's partly an answer to one of the other questions, but what happens is the front-facing public portion of a business will do everything just right. Maybe the manufacturing portion of a business on the line, on the processing line, will do everything just right, and then it's break time, and the masks come off, the food comes out, people cluster and talk and gather, and that's where a lot of the problems have been occurring, we think. Of the workplaces involved, they've included manufacturing, construction, restaurant, retail, and healthcare, and there's not been any recent, of those 99 cases, none of those involve more than 2 people at a workplace. There were much bigger outbreaks involving 7, 10, 15 people, but those we're seeing the tail end of that, and I think that's pretty good evidence that what we're doing with coaching businesses is working.
Right.
The 13 cases of those 99 were from just plain social events. Have a party, have a birthday party, have a barbecue. 2 of them were from informal daycare settings. We've had no transmission in the recent few weeks of formal daycares, and that's because they are just far more careful. And then the out-of-county travel accounted for 7. That was trip to Yakima, trip to Winthrop, Montana, California, North Carolina, and Alaska. There's nothing magic about those places. Some of them have a little higher rate than here, but not much. What's different is that when people decide to go on a trip, they sort of forget that they're supposed to be just as careful as if they were at home. Because what happens in Vegas doesn't stay in Vegas. Yeah. So, and then the second part of that question, well, one other thing that was a commonality across many of those groups is a shared vehicle. So people going to a work site, people traveling together. In a car, it's very difficult to go on a trip and wear a mask the whole time. And oftentimes people will go to, well, for example, when the protests were big in Seattle, we had a couple of cases that probably weren't from the protest. They were from the car ride down and back. So that's important. And if you're not of the same household and you're sharing a car ride, you should at least mask and try to be, separate. Mask use is important. Especially in places where you can't maintain the 6 foot that are required. And there's just no question in any medical person's mind that the mask is important. You think about your surgeon. Can you imagine a surgeon spitting in the wound before he sewed it up? But if he didn't wear a mask, that's what he would be doing during the entire procedure. So the surgeon doesn't wear the mask to protect himself. He wears the mask to protect the patient. I guess that's my age, talking about surgeon in the he. I guess we have a lot of she surgeons in Skagit, so. So mask wearing at home is not feasible just because you live there and it's not comfortable to wear a mask that entire time. And so within your own household, you kind of accept that there's going to be transmission. If you know someone's ill, then we try and recommend quarantine and isolation with much stricter separation guidelines than they would get if you just lived in the same household. One other thing about that is we have had no outbreaks in the congregate settings like nursing home, retirement homes in the last 2 to 3 weeks. The last outbreak that we had been greater than 28 days ago, so it's considered over. 28 days without a case.
That's wonderful.
Yeah.
Good, good. Okay, so question number 4. Why doesn't the county release information on where specific cases are being reported, like what restaurant, what apartment complex, so that people can avoid going there and being exposed?
So traditionally in public health, we're very private about our people's information. We don't advertise the name of the person with gonorrhea. That would probably work, but it would cause so many social problems that you just don't do that. There are a few exceptions to that rule. One of those is measles. If we know of someone who was at the airport, for example, on a certain day, who has measles, who was contagious for measles, we will advertise that event, not the person's name, but we'll advertise the fact that there was someone contagious with measles, because measles has an R transmission, an R naught value of 18 compared to just a little over 1 for COVID. So because it's so much more transmissible, then it's important to find everybody who was there. With COVID and diseases similar to COVID, the way contact tracing and investigation works is it identifies the places where the person was, and identifies the people who were potentially exposed to that patient, and then we contact all of those people individually. So, for example, on the person I mentioned that had over 20 contacts, we talked to each one personally, and we're required to do that. We're required to contact a confirmed case within 24 hours and get the information from them, and then we're required to contact their contacts within 48 hours to isolate and quarantine them. Isolation is a term used for a person who has the disease or is asymptomatic and exposed, a person who has the disease confirmed, or a person who is symptomatic and has been exposed. So we isolate those people, assuming that they're sick. Quarantine is used for people who've been exposed but show no laboratory or physical signs of illness. So when we identify a location, whether it be a workplace, a restaurant, a hair salon, what we do is far better than notifying the public about the incident. What we do is stop the disease transmission in that facility in its tracks by excluding people who have the illness or who have been exposed from work for an appropriate amount of time. We ensure that the physical structures, the physical or engineering strategies are in place, whether it be screens or distancing or ventilation, whatever. We pay close attention to that, and we pay more attention to enforcing the masking regulations. And so that place then was last week's outbreak is now the safest place in the county this week. So that's why we don't, advertise, because it's not fair to the business and it's not fair to the public in general to make the assumption that that place is somehow contaminated and you shouldn't go there. Like I said, we've done one better than that. We've taken the disease out of the place. Now, if a business has 6 employees and every one of them is quarantined, then their business is shut down for a couple of weeks. And that's what happens in dental office, for example. So the reason for doing the contact investigation we do is simply to stop the spread of the disease, number one. That's our primary thing. And it's also to look back at who may have given that person the disease so that we can look for another pathway of transmission that we don't know about. And by doing those things, we can alter the behavior of the people who we know have the disease or who have been exposed, so that they are far less likely to transmit the illness. In talking about that 99 cases that we had, 23 of those, we don't know where they got it. And that's bothersome. What that tells us is there's undetected community transmission going on. And for people to say at the highest levels of government that we're testing too much, and we should cut back on testing, I mean, that's ludicrous, because we're never going to identify this unseen transmission unless we test asymptomatic people. So we've, just as a side, we've not made any changes at a state level or at a county level in our recommendations for testing. I think it's unnecessary for someone to go get tested every week just because they're worried. If they're in a position where they could be exposed, then that's logical. It's also illogical to have an exposure over the weekend, or a potential exposure. You let your hair down a little bit, you went somewhere you shouldn't go, you got too close to people, you weren't wearing a mask, so you go in on Monday to get tested. That's not helpful, because it's too soon on Monday to know whether you got the illness over that weekend. So we recommend 5 to 7 days.
Okay.
Yes.
Like within the week, though. Yeah.
Excuse me?
Within a week.
Yes.
Yeah. And I know you've kind of answered, this is question 5, and you've touched on this a bit, and maybe you can add to this. Is contact tracing effective, and how does it slow the spread?
Right, we did talk about most of that. And yes, it is effective. It is one of the best ways to change the R-naught number, to limit the number of people who get illness from the people who have illness. The best way is masking. The best tool we have right now is masking, and that's unequivocal. It's been shown in population studies before and after masking. It's been shown in places where they simulate virus transmission. I mean, there's just no question. And, I guess maybe the lesson there is you should get your medical information off of a medical site and from a medical expert rather than from a political website.
Okay. Question number 6. I keep hearing we might have a vaccine soon. How soon? And where will I be able to get one?
So we are actively planning for vaccine distribution. The CDC and State Department of Health have informed us that we will probably have limited supplies of vaccine available as soon as November or December, assuming the trials continue to go as planned and we don't find any unusual problems with the vaccine or have any problems with the vaccine manufacturing and distribution. Now, there's not going to be enough vaccine initially to vaccinate everybody. And if you look at the numbers of people who need to be vaccinated and the ability to deliver that, it's going to take 4 or 5 months going full out to get everybody who wants a vaccine vaccinated. So we initially will pick the highest risk by virtue of age and associated illnesses, and by virtue of ongoing exposures. For example, CCU staff would be one of the highest priorities. And and these are decisions that I don't make. These are decisions that are made by a group of experts in the ethics of medicine and in the science of COVID. And they're hopefully going to be universal throughout, so we don't have people traveling from county to county, trying to get the vaccine as soon as they can. So all that's being done and planned for. We plan to use our Skagit County test site at the college as a dual-purpose site once the vaccine is available. Continue testing there, but to also offer vaccine. We also will use all of the usual sites that give vaccinations, providers' offices, the hospitals, and the pharmacies mainly. We may also do some mobile outreach programs for people who might otherwise have trouble accessing the vaccine. And then the nursing homes, congregate care facilities would all give their own vaccines. They would have their own little clinic there. That's the plan.
You know, in addition to that, I heard or was told last week that I should get a flu shot right now,
Yes.
and so that it's not close to the COVID time of getting the vaccine. Is that your recommendation?
Yes, it is. I think we need to encourage as many people as possible to get their influenza vaccine. Certainly don't not get it out of fear of exposing yourself somehow to COVID. I mean, the doctor's offices, we've proven with our contact tracing, are safe places to be, and the pharmacy is a safe place to be. So get your vaccine, and then influenza is off the table. And if you get the sniffles, you get a cough, you think, oh, am I coming down with influenza or the cold or COVID? So you don't have to worry about influenza then. So it'll take a burden off the healthcare system, because if we can get a high enough level of influenza, we won't have an influenza outbreak this year.
That would be great. Okay. So, question number 7. What is antibody testing, and why would I get it?
So antibody testing. Antibodies are things that they're essentially chemicals that the body makes that specifically match something on a germ, whether it be a virus or a bacteria, or even sometimes non-infectious things. So they match in such a way that they act as sort of stormtroopers, I guess to use a World War II term, where they initiate a response to fight that, whatever it is, that germ. And if the body has never seen a germ before, the process of fighting the germ takes a lot longer to get going, and often you get behind the curve. If you have antibodies, whether they're antibodies from previous illness, antibodies from what's called convalescent plasma, that's antibodies that are passively taken from one person and given, who has had the illness, and given to someone who's sick with the illness, or whether they're vaccine-instigated antibodies. They are the same things in all that group. There's no difference between an antibody produced by the vaccine and an antibody produced, well, it's produced by the body, really. It's not produced by the vaccine, or one produced as a result of being ill. And they give you a jump on fighting the infection so that you can get ahead of it before it becomes well established. And they can either completely eradicate the infection before it really even gets started, or they can tamp it down enough so that you have a modified, much less severe form of the disease. So in either way, they're helpful. And antibodies produced by vaccine vary from illness to illness. In fact, antibodies produced by natural illness vary from illness to illness. So some diseases you can get again. Some disease, it's because the antibodies are short-lived, wear off, and then you get infected. Other diseases, you have lifelong immunity once you've gotten the illness, because those antibodies last forever in your body. So there are 2 types of antibodies that we measure. One's called IgG, and one's called IgM. IgM occurs first, starts being produced just as soon as the body's aware of the illness, and is consistently measurable by 21 days or so, and then goes away. IgG is a later responder that is kind of like the backup long-term memory of the body. And it appears at around day 21 or thereafter, and then we don't know how long it lasts. So antibody testing is mostly a curiosity, to be truthful, because if you think you were sick, weren't tested at the time, and you go back now and have an antibody test, and it says that, no, you didn't have it, that's probably true unless a long time has elapsed. or if it says you did have it, there are measurable antibodies. We don't know how protective those antibodies are. We are seeing situations where it's pretty well documented that a person has gotten a second case of COVID. And that's because their antibodies wore off, or it's possibly a different strain. That's really been, I mean, there's been like 5 or 6 documented cases worldwide. So you cannot use the antibody test, a positive antibody test, as a passport for not doing the mitigation strategies. I mean, if you have positive antibodies, then you're probably far less likely to get it than someone else, and if you do get it, it will be less severe. But you still might be contagious during that time. You might actually get complications of it, so don't depend on an antibody test. Now, the 2 other times that they're very useful is for doing seroconversion rates in a, like say Pierce County, Skagit County, if you tested enough people in Skagit County, you could figure out how many people in the county likely had the disease. So seroprevalence is a useful number for planning, but it's not a useful number to help the people that are currently ill. One other time that it's useful is identifying those people who have antibodies so that they can donate plasma and donate their antibodies, essentially.
Well, thank you. That's very interesting. Well, we've had some great questions, and I'm wondering if you have anything else you'd like to share, questions that you think are important to be answered, or any additional information.
No, I think this all goes back to, this is an illness which is controlling us right now. These strategies that we've come up with to mitigate this are universally based on the experts' opinions, multiple studies that have been done, and a consensus of opinion. And it may seem like it's kind of hard to follow sometimes because we, at one point, recommended against wearing masks. Now we recommend wearing masks. And it's not because we changed our mind for no reason. That's because the evidence became overwhelming that that's the way we should go. And that happens all the time in medicine. It's just that it's not on front page news. It's not in campaign speeches. It's not part of just, it goes on behind the scenes. And, medicine changes dramatically over time as we learn more. And we've certainly learned a lot about COVID, and I think that, we're gradually narrowing in on the things that works. Masks work. Distancing works. We're finding out a little bit more about the possibility of airborne exposure. I mean, are you and I truly safe from each other when we're 10 feet apart? And in certain situations, we maybe aren't, which is why that wearing a mask is so important. That's why it's safer to do things outdoors. But when you do things outdoors, the disease can still be transmitted, and if you're in a group setting outdoors, you should be wearing a mask. If you're on the trail by yourself, you don't have to. But if you're in any sort of a group, you need to be wearing a mask. And it's been proven effective to help. So gather small, gather safe for the Labor Day holiday. And, when you've made your decision to do something, and it maybe doesn't quite meet the guidelines, but you got to do it, or you want to do it, or you feel compelled to do it, but do it in a safe way. And that means, hand washing, surface decontamination, sanitizing, distancing, and masks. So doing something that, gathering in a group of 10 people, for example, it's not something we'd want to see, but if it happened, it sure would be far better if people did everything they could to prevent transmission in that particular setting that they've chosen to become involved in.
Thank you, Dr. Libran.
Thank you for having me.
Yeah, we just appreciate your leadership through this pandemic, and all your decisions based on science, and And so please, know that we in Anacortes are really supporting you, and we know what an important role you're playing right now, and your shoulders are carrying a lot. But thank you. Thank you from the city of Anacortes. Thanks for being with us today.
Well, I'm certainly not doing this by myself. I mean,
I know, you have a team.
The team at the health department is just amazing. So.
Yeah. Well, we appreciate every one of them, and I know here in Anacortes, the community is really working hard to stay safe. So I want to thank you all for being with us here today. I want to remind us to stay vigilant with our safe practices to protect all of us from COVID-19. This week, the weeks have turned into months, but we must stay the course. Please watch out for each other. In addition to the inconvenience of wearing a mask and hand washing and staying 6 feet apart, there is also the emotional toll that many are experiencing, from isolation to financial stress and the uncertainty of how long this will last. Please provide understanding and grace with everyone you meet. We do not know what challenges or hardships this has brought into their lives. Most importantly, please take care of yourselves. Make sure you have what you need. Take extra time. Ask a friend, a family member, or a neighbor for help. Together we will prevail. Together we can be resilient, and Anacortes will thrive in the long term. I will see you for my next briefing on September 16th. And next Wednesday, September 9th, we will post our COVID-19 briefing memo on the city's website and on our social media with any updates that happened over this next week. Have a good night and stay safe.